Hi, I'm Shivani. We have Dr. Vidya with us, consultant psychiatrist. Hello, ma'am.
Hi Shivani, I'm Dr. Vidya. I've done my DPM, DNB and MRCP Psychiatry. I have 10 years of experience in the field of psychiatry. I'm a consultant psychiatrist. I lead the Acute Psychiatric Services in Maarga. I'm also interested in child and adolescent psychiatry, neuropsychiatry and palliative psychiatry.
Thank you, doctor. So, can you tell me what is acute psychiatric services that provided at Maarga?
The acute psychiatric services that we have is acute psychiatric inpatient care and a crisis management team. So we basically have a highly structured level of care which involves meeting the needs of those with severe behavioral and emotional issues or those who are at risk of endangering themselves or others around them.
So, doctor, typically who require these services?
Typically the acute psychiatric services are taken by people who are in extreme emotional distress, and those who are having severe depression, are highly suicidal, aggressive patients, patients who have behavioral symptoms secondary to medical disorders due to substance use disorders as well.
So, doctor, can you please tell us what are the processes that are involved in acute psychiatric services?
Usually when the patient comes to us, we do a basic risk assessment. If the patient has high level of risk, we admit the patient to our psychiatric intensive care unit. We have a 6-bedded psychiatric intensive care unit required to manage patients who are very difficult to manage otherwise in ward. In the initial few days, the patient is in the psychiatric intensive care unit. Once the patient is doing well and is more approachable, the patient is shifted to our inpatient ward unit, which is around 30 beds now. And in the inpatient ward units, we have medication optimization for the patient. We have counseling sessions which can be individual therapy. Sometimes the family is also involved in the family therapy sessions, couples therapy as well as group therapy. We also have other services like electroconvulsive therapy, which may be required for some patients who are very aggressive, difficult to manage, highly suicidal patients. We also have various psychological assessments done which helps in the management of patients that are admitted in the wards. Also we have de-addiction services, rehabilitation services for long-term care for psychiatric patients as well as de-addiction patients. We also provide respite care.
Doctor, can you tell us about your team?
In Maarga, we work as a multidisciplinary team. We have a team of psychiatrists, we have a team of psychologists, we have occupational therapists, social workers as well as nursing staff who are involved in the care of the patient. Today we've discussed about acute psychiatric services at Maarga. Maarga is a tertiary psychiatric hospital setting catering all psychological needs and distresses, and people with psychiatric problems can come to Maarga and seek help.
Thank you for your valuable information, doctor. I hope this was helpful for everyone. Thank you.